Community Analysis of Safety Harbor, Zachary Green. Contents: History of Safety Harbor, Community Analysis, Structure, Population Demographics, Health Resources, Environment, Government, Local Needs, Global Issues. History of Safety Harbor. Prior to colonization by Spanish conquistadors, the land of Safety Harbor was cultivated by the Tocobaga tribe. After much time, Mr. Philippi, a prominent member of society in his time, brought riches to the area through means of citrus crops. He would later go on to donate the land that is now Philippi Park. The city was officially and legally established in 1917, for which it is currently celebrating its centennial birthday. Community Analysis, Structure. The windshield survey showed that the city of Safety Harbor has enough housing for its population. Demographic data also shows that there is still plenty of housing available for those interested in moving to the area. There are several groups within and nearby the city to assist with the physical, mental, and financial well-being of the community, as is discussed later in this presentation. There are several parks within the city, and the plan is to continue park expansion with improvements to the waterfront park currently underway. Safety Harbor fosters an active community in which festivals are held often. It also has a Pokestop near the waterfront park, which draws large crowds on a regular basis. During times of festival or high traffic, or when the waterfront Pokestop is busy and bustling, parking becomes an issue. People have taken to parking illegally, which has resulted in problems with law enforcement at times. Community Analysis, Population. Over 8,000 housing units provide shelter for over 17,000 people within the city. This averages to just above 2 people per home. There is still 10% of the housing within the city available for those interested in the area. Those who live within the area tend to speak highly of their hometown and how close they are to everything from healthcare to recreation to groceries and anything else they may want. The people do not tend to express need for assistance with cancer education or aid. Statistics, however, show that this is the #1 cause of death within their community, which emphasizes the need for education at the least. Community Analysis, Community Health Resources. Anything the city of Safety Harbor lacks within its defined boundaries is available within a 20-minute drive. This is in no way to insinuate that the city is lacking in healthcare resources. They have consulate health care to provide skilled nursing care to the elderly whose family cannot provide needed care at home. Their daily charge is $295 for private rooms and $195 for semi-private rooms. Women's Care Florida is located just west of Safety Harbor in Clearwater and provides for obstetrical, gynecological, and perinatal care for women in the area. Prices and insurance matters are not openly listed. The Safety Harbor Neighborhood Center provides care for those within the community who need financial assistance such as food, school supplies, or job assistance. There is no charge for their services, but donations are always welcome. This is in line with 2 of the Healthy People 2020's goals, including the decrease in proportion of persons living in poverty and decrease in food insecurity. These are important factors to support in every community, as they are basic needs as described in Maslow's hierarchy of needs. Personal and family counseling is provided for by the Family Psychological Association of Safety Harbor. They are available every day besides Sundays, but specific pricing for services is not listed. Within city limits is Morton Plant Meese, which provides all-encompassing care for the area. Their primary care is specifically notable in that the Healthy People 2020's goals include increasing the proportion of people who keep a primary physician. Primary care physicians are important for every person's life and can help to lower cost of health care by providing preventative or early recognition care rather than waiting for one's health to reach emergent levels. Community analysis, environment, sanitation. Water is abundant in supply throughout the city and its parks. The city appears to take pride in its cleanliness, as litter is hard to find in its parks, residential areas, or elsewhere within the city's boundaries. The only animals seem to be squirrels, birds, and fish, which do not seem to bother the local population. In the event of animal disturbance, however, there is a 24-hour service which will come to assist with safely removing any dangerous or nuisance animals. Community analysis, government structure. City meetings are held on a bi-monthly basis and from video footage appear to be well attended, with standing room only for those who arrive late. Members of the City Commission are available at these meetings to discuss public concerns and needs, including the city's budget. It takes little to see that the city is well cared for, but the community has done well in ensuring that the budget is well above their needs and has held a record of surplus for the last several years. The only thing that may be seen as a problem in the city is in connection with the waterfront park. Plans that have been made, including plans for online updates, appear to not be moving as projected. The last update was in late 2012, when the property itself had been purchased in that same year. The number one risk to life within the Safety Harbor community is cancer, as its number one killer. This emphasizes the need for education and assisting the locals with their health and prolonging as long as possible their lives. Heart disease is the number two killer within the community. 20% of people in Pinellas have not had cholesterol checked, and 47.9% of those have reported high cholesterol issues, while 36% of those have high blood pressure. Hospitalization for heart disease in Pinellas is less than that of the state, but death from heart disease is higher, thus, again, reinforcing the need for education. Job stability stems from a lack of education. 28% of those 25 years or older have a less than 9th grade education. So advocacy for GEDs and completion of high school is important to assist those with gaining and keeping their jobs. Smoking cessation is important for those, not only for their health, but also because smokers are a burden on their employers due to decreased productivity and an increased cost for health care. Only 40% of those in Pinellas are aware of phone helplines for smoking cessation or other assistances available. This provides evidence that there is a need for education on the available resources for smoking cessation. Even educated non-smokers can have a difficulty with job stability, though. There is a need for job assistance as evidenced by the community resources available within Safety Harbor. This and the other employment-related local needs might have been higher on the list if Pinellas County didn't have 90% of its occupants already employed. They are still a part of the list of local needs due to their importance related to Maslow's hierarchy of needs as far as gaining what one needs to survive. Parking at the Safety Harbor Pier, Marina, and Waterfront Park is lacking and really one of the only physical aspects of the city that isn't up to par. Global issues, cancer education. While death rates have slowly declined in regards to cancer, it is still the leading cause of death in Pinellas County. Black community members have remained much more likely to suffer from cancer than other racial groups. It is important to reach out to members of the community to teach lifestyle habits which prevent and detect cancer. While advocating for awareness is utilized within Pinellas County, there is still more that can be done. Testing, including colonoscopy, mammograms, prostate examination, and the use of sunscreen to prevent skin cancer is imperative. Primary care doctors are of utmost importance in prevention and early detection of cancer, especially in reference for testing and screening as mentioned. Globally, cancer is a burden that is difficult to deal with in part due to the sheer cost of treatment. In Italy, specifically, There are groups working to make care affordable and that are advocating for prevention and early detection. They are also working on cancer research while gathering the brightest minds within the country.